I'm going to be discussing Chapter 14, Psychology Disorders. Concepts that we will be covering today are phobias, postpartum depression, and schizophrenia. Phobias. Phobias are irrational, persistent fears of an object, situation, or social activity. People with phobias have trouble hearing, seeing, or talking about the phobia, which basically means that they can't be around it, speak about it, see it in a picture, even a video. It just really freaks them out. There are 3 different types of phobias recognized by the American Psychiatric Association, or APA. Some facts about phobias. Phobias are more serious than simple fear sensations and are not limited to fears of a specific trigger. Despite individuals being aware that their phobia is irrational, they can't control it. So they basically can't control their fear reaction. More than 19 million people in the U.S. have a phobia. Here are a couple of causes of phobias. Phobias usually develop in early childhood, teenage years, or young adulthood. They can be caused by a stressful experience, a frightening event, or a parent or household member with a phobia that a child can learn from. So whether you experience yourself, you have a traumatic experience when you're a child, or a teenager, even a young adult, or you can also maybe have a parent that has a phobia and you were able to learn about it, so now that you have the phobia. Specific phobias usually develop before the age of 4 to 8 years. It could be the result of a traumatic early experience. It can also be caused by a witness phobia of a family member. Complex phobias are social phobia and agoraphobia, and these phobias need more research to confirm. Researchers believe that complex phobias are caused by a combination of life experiences and brain chemistry and genetic. Some of the symptoms of phobias are dizziness, trembling, and increased heart rate, breathlessness, nausea, a sense of unreality, or a fear of dying. And there are a few more symptoms of phobias as well. They do have treatments for phobias. These phobias can be cured by cognitive therapy techniques. This is when behavioral techniques expose the individual to the feared situation. These behavioral techniques can be used either gradually or rapidly, and the patient is taught how to stop the panicky reaction and how to regain control of one's emotions. Another technique is exposing the patient to the fear, whether they gradually introduce them to their fear in a live controlled environment or by virtual reality, which exposes the patient to their fear virtually. Postpartum depression. Postpartum depression is a mood disorder that can affect women after childbirth. Mothers with postpartum depression experience feelings of extreme sadness, anxiety, and exhaustion that can make it difficult to complete daily care activities for themselves or others. Here are some causes. After childbirth, the level of hormones in a woman's body quickly drop. When this happens, it leads to chemical changes in the mother's brain that may trigger mood swings. Many new mothers don't get rest that they need to fully recover from childbirth. Constant sleep deprivation can lead to physical discomfort and exhaustion, which can lead to postpartum depression. Many mothers suffer from postpartum depression. Luckily, there is a treatment. Postpartum depression has been known to be treated by 2 different types of counseling. One is cognitive behavioral therapy, or CBT, which helps people recognize and change their negative thoughts and behaviors. Or there also is interpersonal therapy, IPT, which helps people understand and work through problematic personal relationships. Postpartum depression can also be treated with medication. Antidepressant medications act on the brain chemicals that are involved in mood regulation. Here is the short video of a few women that have battled with postpartum depression.
I didn't know how Everyone I knew, I felt like had the most wonderful experience after they had their baby, but I didn't know how to say, like, I am freaking out.
Postpartum depression to me is the disconnect you have with your baby.
An overwhelming, uncontrollable sense of anxiety.
One of many mental illnesses that can affect mothers.
When I got pregnant, I was instantly in a bad mood. In addition to that, I had fibroids, which are tumors that grow in your uterus, and it was really scary.
I knew I had postpartum depression from the first time when I went to go and pump my breast milk at work, and I just broke down crying.
I actually remember saying to my husband, you know, people kept saying I'd be so emotional and I feel fine. And the reality of the situation was that I was completely emotionally numb.
Right after I had the baby, it was my husband's birthday, so I baked him a cake and I invited people over, and people were like, "What are you doing?" But I felt like it was my duty to celebrate his birthday, to try to nurse, and then come back and put on a happy face.
I believed that every parent around me knew what they were doing and that I was this devastating failure.
When my son was 4 months old, and I remember breastfeeding him, but he wouldn't stop crying. And I got face to face with him and I screamed, "Stop crying." That was probably the moment I realized I needed help.
It's a really defeating feeling, knowing that this is something you have no control over.
I thought after that moment, I just need to hold my baby. I don't ever want this to happen again, and something has to change.
Being a stay-at-home mom was really isolating, but I felt like I kind of came out of it when I started exercising and hanging out with other moms.
I started feeling better when I could wake up to my baby every morning, and he just makes everything better and everything worthwhile.
To all the mothers going through this, surround yourself with people who get it, because you're not alone.
I know there's so much pressure right now to be like a perfect mom. You have to be honest. You have to let people in and let them know what you're going through.
If you are out there and you are struggling, I want you to know that it is going to get better.
I'm a mother, and I am vulnerable, but I am capable.
And I am fighting every day.
And I'm doing the best that I can.
And struggling with postpartum depression didn't make me weak, but becoming victorious over it, that's what made me strong.
We have lost way too many moms, so please stay with us. Find yourself a community and keep fighting.
Schizophrenia. Schizophrenia is a severe disorder in which a person suffers from disordered thinking, bizarre behavior, hallucinations, and inability to distinguish between reality and fantasy. There are 4 different types of schizophrenia: disorganized, paranoid, catatonic, and undifferentiated. Paranoid schizophrenia. When a person has hallucinations and delusions, they hear voices, sound effects, and believe that everyone is out to cause them harm. Disorganized schizophrenia is when a behavior is bizarre and childish, and thinking, speech, and motor actions are very disordered. They giggle or laugh at inappropriate times, mumble or ramble a lot, and have obscene behavior. Catatonic schizophrenia is when the person experiences periods of statue-like immobility mixed with occasional bursts of energetic, frantic movement and talking. They can stay in one spot for hours and days, and when they wake or start to move, they can become violent. Undifferentiated schizophrenia, this is a mixture of different types of schizophrenia. So they might have a few types from the different categories, like they might have a few types from paranoid and a few from catatonic. It's just a mixture of all of them. Here are some causes of schizophrenia. Schizophrenia can be inherited. If you were exposed to a viral infection before you were born, your chances of getting schizophrenia is higher. If you didn't get proper nutrition within the first 6 months of being inside of your mother's womb, can also lead to schizophrenia. Also, low activity in the frontal lobe. drug abuse, or even a traumatic experience that you experienced when you were younger or in your teens. This could also lead to schizophrenia. Some of the symptoms of schizophrenia include hallucinations, delusions, disorganized thoughts, reduced speech, even when encouraged to interact, lack of emotional and facial expressions, diminished ability to begin and sustain activities, decreased ability to find pleasure in every day, also social withdrawal, also memory, attention, planning, and decision making. Schizophrenia is a lifelong disorder, but there are treatments that can help keep schizophrenia controlled so that it doesn't take over your whole life. Schizophrenia can be treated by lifelong combination of medication, psychotherapy, and coordinated specialty services. So there are different types of therapies that you can seek, and also different type of medication that they can give you to help keep your schizophrenia under control. My husband's mother has schizophrenia. Here is a video of our interview of how it affected his childhood and growing up, as well as his relationship with her now. So how long has your mother had schizophrenia?
I was told that she didn't show signs until I was born, but later I discovered that one of my aunties, her sister, told me that she had displayed signs of it later in her teen years.
How has it affected your childhood and growing up?
As far as her being able to cope and balance life with just issues all around, like just regular tasks, mundane, like paying taxes, paying rent and so on, and being able to focus. We've been evicted a few times. I've lived with other members of our family. We've gone from apartment to apartment to being homeless. So growing up, I've missed a lot of school and things of that nature.
What's your relationship like with her now?
I find it more difficult now than it was in the past, because easily I could run away and go to other family members, and primarily my grandmother. Now it's harder to understand it or handle it or deal with it, because I'm now a family man and a husband, and trying to balance her issues with mine. It's very difficult.
How does that make you feel?
Well, obviously it would make me feel very disappointed within myself that I can't balance life with other family members in my current family that I'm growing and developing with. But all in all, I know some things are out of my hand and I can't control.
Thank you for watching.